leave Ukraine for now and come back onto health. And Debbie, do we all need an MOT?
I think some of us are going to, yes, for sure. But things have been pretty desperate in A&E. We've been talking about corridor care, we've been talking about cupboard care even, and things have been getting a bit desperate in Kent. And I picked up this story where a patient who'd got fed up with waiting in A&E for so long had contacted his friend, and his friend had brought in a mattress so that he could lie down on the floor in A&E because he didn't feel very well. There was altercations with nurses. He got told it was an infection risk. He got told it was an obstacle, and he had to remove the mattress. However, we need to keep our eyes on A&E. And I picked up this story as well in Sky, which says that you're going to need a health MOT if you want to get through the front door of A&E. And I was absolutely horrified, and I needed to have a look a little bit further on because apparently this is going to be a lifeline. And what it's saying is that over 1 million people over the age of 75 are admitted each year, and a fifth of them are frail. It says that there'll be MOTs at the front door, and you'll be told to give a history of falls, and maybe you'll need to have your blood pressure done, and you'll need a review. But what are these tests? Are we going to be asked to have PCR tests? Because they're looking at people over the age of 65 to have all of these tests. These tests are going to be available 10 hours a day, literally. But my question is, what tests are you going to be asked to have before you get admission into A&E? So I went to look at the urgent emergency care recovery plan, which they were talking about. And of course, this isn't about recovering patients. This is about recovering the service. So when we look further in at the plan, we can see that actually they're looking at discharge. They want people to be discharged as soon as possible, and they're going to transfer people into care transfer hubs. They're spending 1.6 billion, literally focused squarely on discharge. So what they're saying is that 20% of emergency admissions can be avoided with the right care in place. And all of this is going to be about frailty. So ahead of next winter, they're going to offer what they call joined up care. And this means virtual wards. But actually, what is a community care hub? Well, I can tell you what a community care hub is. It's not, I was thinking maybe it was a porter cabin in the car park of the hospital. It isn't. It's a team. So for people that don't pass the test to get through A&E, they will be sent home, and a community care team, whoever that is and whatever qualifications they have, will be sent to your home. So this isn't a hub as such that you people will be placed in. You will literally be sent home, and this will be your bed or a hospital bed in your house. So they're trying to make us as sick as possible and then deny us access to emergency healthcare, or at least make emergency healthcare conditional. And I have heard that the age limit for this MOT may be reduced to 55. So we need to be keeping an eye on what is going on in our hospitals, especially A&E. And if you're elderly, if you've got an elderly relative, we really need to be thinking, what are they going to be asked to do before they get through those A&E doors?
Well, indeed, Debbie. And of course, the problem is that the reason that people are queuing up at A&E doors is because they have no access to primary care locally. This problem is not going to go away in a hurry. So, surely the issue here is that we've got to get GPs functioning properly.
100%. And it's very telling to know that there are lots of GP vacancies. And there are GPs out there that are saying they're twiddling their thumbs and they're doing nothing. So what is going on?
Okay, thank you, Debbie. Now, Ben, let's come back to you.